All right. Good afternoon, Frank. I'm Jim. I'm washing my hands right here for you. I'm Jim. I'm going to be your assessor today. How are you?
Very good. Very
Good. What brings you in today?
Just a checkup.
A checkup? Okay. Do you have any past medical history?
No problem.
No asthma, eczema, any heart issues, any cancers in the family, anything like that? Diabetes, sugar problems?
No.
No? Are you having any hearing or eye issues?
No, I don't see as well as I did.
Okay, we'll be sure to take a really good look at your eyes. Now listen, what I'm going to do today is I'm going to try to give you some information on your health. I'm going to be explaining what I'm doing. I'm also going to try and break it down for you so you'll understand what I'm looking at and why I'm doing it. Okay? We'll go ahead and start with, let's just do some basic, just a quick look. I'm just going to look and see how your skin looks. Okay. Facial features, eyes, ears, nose, lips, all appear to be symmetrical, bilaterally. They also seem to be aligned. That's good. I see no growths or any damage of any type that I can find. No masses around the auricles of the ears, on the side of the face of the eyes. I'm looking at the skin on the back. Looks good. You have a couple of small moles here. They appear to be pink and regular size. Have you seen a dermatologist for that?
I haven't.
No, you haven't? Okay. It's one of the things we look for to make sure that there's nothing like skin cancer that we have, which is kind of prevalent in our area, so you might want to keep following up with that and make sure we do okay, okay?
Sure will.
Now I'm going to just drop the front of you again for you. Check your skin here. Do you have any tattoos, piercings, surgical scars of any type?
No.
Okay. You have what we call good skin turgor, okay? I can see that you've got really good skin, which means that you're well hydrated. I don't see any growths or abnormalities there. All right, hold that up for you. I'm just going to take a quick look down here at your legs, do the same thing. Have you been having any numbness, tingling, anything in your legs or arms, fingers, toes? No? Okay. I see no edema. You've got good hair growth. It's symmetrical on both sides. No growths, no abnormalities. They both appear to be the same on both sides. All right. All right. So I tell you what we'll do. We're going to go ahead and start with an exam. I'm going to go ahead and start looking kind of at your eyes, ears, nose, and throat. See if we can make sure everything looks good. Okay? So we'll go ahead and start with these little light things set up here. All right. I have this little mechanism called an ophthalmoscope, a big word for something to check your eyes. Okay? What I'm going to be looking for is to make sure that your eye structures look good. We're looking in for some of the normal physiological signs, the body signs we have as we kind of look at you to make sure that everything looks healthy and good, okay? So what I'm going to do is I'm just going to ask you to look at that box right there ahead on the wall while I kind of look at you here. All right. All right. Okay, good red reflex over here on the left eye. Coming in close. Light will be a little bit bright, okay? Let me know if you experience any pain or any discomfort for any of my assessments, okay? All right. I can see the optic cup and the disc. It looks normal. I see no Dresden bodies. I see no cotton patches. And all the arteries and veins look good there. One second, across here, excuse me. All right, do the same thing on this side. Keep watching that box on the wall for me. Come in over here. All right, coming in, red reflex, good. All right, coming in, I'm going to kind of come close to you here. All right, here I can see the optic disc and cup. I can see the arteries and veins, and they look good. I see no nicking or any abnormalities, so that looks good.
The retina nerve is in there, or where's that?
What's that?
The nerve?
The optic nerve?
Yes.
Yeah, you can see that back in there. All of your vessels look good. It looks like it's being fed well. I see no abnormalities or irregularities, and it's very, very visible, which means that's good. There's no growths in there to show us. Okay? Now, what I want you to do is watch my fingers. Move only your eyes as I move my finger, okay? Okay? Now you follow my finger to the tip of your nose. Okay, good. We're getting good responses to that. Let's go ahead to, I do want to check and see. You just look ahead at that box again. Okay, we have good perla on the eyes. The pupils are equal, round, reactive to light, and accommodating. So that's all good things there, okay? Structures are all looking good on that. All right. So let's go ahead here. What I'm going to do now is go ahead and take a look at your ears. Now, I'm going to try not to cause any discomfort. If you have any discomfort while I do this, let me know, okay?
Sure.
I'm just going to pull your ear back a little bit. I'm going to look right in here. Let me move my glasses again. Make sure I don't hit URI in there. All right. Okay, I can visualize your tympanic membrane. It's gray and pearly. I see a little bit of CeraVent or wax that is in your ear. It's not excessive, and you really shouldn't be using anything like Q-tips or anything like that to clean your ears. Your body will sort of take care of itself. If you use a Q-tip, you can actually damage your ear, but try not to do that. Okay. All right. All right, take a look from this side. All right. Okay. Here again, I see the tympanic membrane. It's gray and pearly. I do see a little bit of what we call erythema, a little bit of redness in here, but it looks like it might just be a little bit of sensitivity. Are you having some sinus issues?
Oh, yeah.
Yeah? Okay, all right. I do again see a little bit of CeraVent, but it looks good. I do see the light reflex on this one. It should be about, well, from the looks of it, it's about 7 o'clock, so that's good. All right. And again, your ears look like they're doing well. We look for things like signs of any sort of skin cancers, growths, or anything like that could be causing some damage, okay? It all looks good. Now, next thing I'm going to do is check out your mouth. If you would, let me put on my glasses. Here's my little light again. I'm not going to put anything in your mouth. I just want to take a look. If you'd open wide. Good job. Now stick your tongue out and say ah for me. Good. You just tested one of your cranial nerves called cranial nerve 9. Tells us you can actually use your vocal cords and that your uvula is staying midline. And it's doing well. Okay. Tongue up. Good. To the right and left. Okay. Now, let's see. Dentition-wise, you've got, looks like you've had a few cavities. You've got a, let's see, a crown. You've got a bridge right there. A good dentition. You have a little bit of erythema redness back in your throat. There's nothing like what we call exudate, which would be pus, which would indicate anything like strep. Is that sinus running right now for you? Okay. All right. And it's, okay, pink and moist. No abnormalities noted. Okay, we'll take a look at your nose now. If you tilt your head back just a little. Good. All right. The nostrils appear to be patent. Are you having any nose issues? Can you smell okay?
Yes, I can.
Yeah? Okay.
My sinuses, of course, are a little messed up.
All right. Well, from here, it's hard to tell because actually they're nice and pink. I see what we call your turbinates, which is these little bony structures that help to moisturize the air in your nose. I also see a septum that is midline, and it looks like you are doing well with that. Good. I'm going to ask you to do me a favor.
Sure.
Use your finger and block off one nose. Breathe through that nostril that you have open. You okay? All right. Now do it for the other one. Good job. Okay?
Yes.
Okay, good. All right, so now I'm going to check for any lymph nodes. I'm going to start right here behind the ears, what we call post-auricular. Non-palpable, non-tender. Do you feel any pain, any tenderness? No? All right, now I'm going pre-auricular, which is in front of the ears. Non-palpable, non-tender. I'm going behind, right below your skull back here on what's called the occipital area. Non-palpable, non-tender. I'm going down the sides of your neck here. Non-palpable, non-tender. I'm following your jawline for your mandibular and mental here. Non-palpable, non-tender. Last one I'm going to feel right in here. Non-palpable nodes, non-tender. Okay. One other thing I'm going to do, I'm going to try not to make this too uncomfortable. So I'm just going to reach around your neck right here a little bit. I want to assess what's called your thyroid, okay? So what I'm going to do is just kind of, if you just put your head down just a little bit. There you go. Good. Now what I'm going to do is reach over here. You can feel a little bit of pressure. I'm just going to push it over to one side. I can feel what you call your isthmus of your thyroid. I feel no nodes. I feel nothing that's swollen or irregular. And the same on your right. So your thyroid seems to be doing well. Can you swallow for me while I hold right here? Okay. I could feel the movement of the thyroid. It looked good. All right. Okay, so now the next thing we're going to do is I'm just going to undrape you here for a second. I want to take a look. Take a look at your chest. Okay. I see no irregularities, no growths. Everything looks good there. Same on the back. I don't see any edema. The hair pattern is normal and symmetrical. Your chest appears to be, yeah, it appears to be what we call symmetrical bilaterally. It's the same, and it's also aligned, so we see nothing going on there. All right? Do me a favor. Push up against my hands with your shoulders. All right, we're checking in on one of your cranial nerves. It's called cranial nerve 11. That's telling us how strong you are. It's 5 out of 5 strength, no irregularities, symmetrical and aligned. Go ahead and push against my hand with your face. Same thing over on this side. Okay, 5 out of 5 strength, doing well. All right, now it looks like I'm kind of assessing the size of your chest here. So our anterior posterior width is about 3/4. Yeah, you've done some working out?
A little bit.
Yeah. So we have about 1 to 1.5 on the size there on the change. All right. So I'm gonna leave this down for just a minute. What I'm gonna do now is just kind of take a listen, okay? Now I'm gonna listen to your heart sounds first. I'm gonna start right up here on the side of your chest. This is where we're gonna be listening to what we call your aortic valve. Okay. I have a normal sinus rhythm. You have a heart rate of of 60. I'm going to listen over here. This is for what we call a pulmonic valve. Okay, auscultated, normal sinus rhythm, no irregular heart sounds. Now I'm going to go down here. This is where we're going to listen for what we call our tricuspid valve. No extra heart sounds there. Sounds good. And now we'll listen to what we call your bicuspid valve. Okay. Normal sinus rhythm, no abnormal heart sounds. That was using one side of my stethoscope. Now I'm going to use the other one. I use first what we call the diaphragm. Now I'll use the bell. I'm listening to the aortic valve. Sounds good. Pulmonic area. No irregular heart sounds, no murmurs, no extra heart sounds there. Listen to your tricuspid. Normal heart sounds. Last one would be the mitral valve. Okay. Good heart sounds, no irregularities.
Where's the aorta? Is that the right of the heart or the left?
What's that?
The aorta?
Well, the aorta is what we're going to assess in just a few minutes. That's actually the big vessel that feeds your body. Okay, it feeds the oxygenated blood to your body. Okay. Now I'm going to listen to another part of your body, which is your heart, your breath sounds. Okay, so I'm going to start in front, work my way to the back. All right. Start up here. Deep breath for me. Good job. One more. Okay. Over here. Okay. Okay. Oh, good job. Okay. Bilateral breath sounds clear to auscultation. No adventitious breath sounds. I'll listen over here now. Okay, one more over here. Okay, and we'll listen back here on your back. Okay, listen to the upper lobes. Right above the scapula. I'm going a little more midline, below the scapula. Okay, one more. Okay, and then down lower. I'm going to go right near the costal margin. Okay, bilateral breath sounds all clear to auscultation, no irregulars there. Okay, now one of the things we'd like to do too is check on your vital signs. So let's go ahead and get a blood pressure on you here. We took one when you came in. The one earlier that we had, just relax your arm form. There you go. The one we had a little bit earlier showed us as 110 over 60, but that was done using a, there we go. I was using our machine, so I'm going to do this by hand now. There we go. Now, just relax your arm for me. Okay, you're going to feel a little bit of pressure here. If you feel any discomfort or any pain, by all means let me know, okay? Okay, I got 115 over 65. That's a really, really good blood pressure. Do you have any family history of any blood pressure issues?
Yes, my father had blood pressure issues.
Yeah? Have you been following up with a cardiologist, or have you felt any need to just yet?
Not yet.
Okay. Well, we need to stay aware of that. Make sure we're doing good with that, okay? All right. Now, let's go ahead and check here on your arms. All right. What I want to do is kind of assess and see what the muscle strength on your body is right now. So why don't you go ahead and grab my hands, pull towards you. Good. Push toward me. Good job. Now squeeze my fingers. Okay, good. 5 out of 5 strength bilaterally. Let's see. All right. I'm going to take a look at your legs down here. I don't see any sort of edema, good hair growth and patterns. Any tingling, any numbness, anything like that? No? Okay. All right. Why don't you go ahead and push up against my hands with your feet. Good. All right. Push down against my hands with your feet. All right. Now pull your toes back to you against my... Good. Push against me. Good. Okay. Now, try to push your legs out from my hands. All right. Good. All right. Let me see your fingers real quick. All right. Try to spread your fingers against my hand pressure. Good. All right. 5 out of 5 strength bilaterally. There's no irregularities in any of that. Now what I'm going to do is go ahead and check some pulses on you real quick, okay? So I'm going to check down here. This is what we call dorsalis pedis. In other words, it's here right above your foot. All right. Okay, so it's 2+, which is normal. That's good. And they're symmetrical bilaterally. That's good. I'm going to check your tibial pulses back here. Okay, bilateral. Equal. All right, that's good. Check your pulses here in your hands. All right. Bilateral and symmetrical. That's good. All right, so now what we'll do is check your carotid arteries. Okay, I'm just going to feel right here. There we go. Nice and strong. Okay. Good right there as well. Okay. Now I'm going to take a listen to see if I can find out if there's any what we call bruits, which are irregular heart sounds. They go in there and tell us if there's any occlusion or any blockages. Okay, no bruise noted on the left carotid. All right, no bruise noted on the right. All right. If you don't mind, I'm going to get you to just lay back there for me and relax a little bit. I'm going to go ahead and kind of feel here. Just kind of gently. Rub and see in terms of what I can find in terms of any irregularities. Warm, dry skin. Hair pattern is regular. All right, now I'm going to take a quick listen to your belly and to your what we call your aortic sounds. We were asking about that a little bit earlier. The aorta is actually the main blood vessel, so I'm going to listen and see if I hear anything from that, okay? Breath sounds first. you don't have to breathe for this part. I'm just listening to your stomach sounds. I'm listening to all 4 quadrants. Good, normal, active bowel sounds. Okay. I just want you to relax. I'm just going to kind of reach in here and just try to see if I can feel that thing we called the aorta earlier. All right. So you can feel it right there. Any discomfort with any of this?
No.
Any pain? No? Okay. Let me listen and see if I hear any bruise from that. Remember, that's an irregular sound. All right. No irregular sounds there, no bruise. So that's good. All right. What I'm going to do now is lay you back. You can just relax. Lay back a little bit. I'm going to lay this down just a little bit. I want to be able to, there you go. There you are. Now what I'm going to do is I'm just get you to relax. Now I'm going to do what we call a palpation or touching of your belly, okay? See if there's anything in there that's painful. There's no irregular masses. No tenderness, no palpation. All right. I'm going to reach over here, just like this. I'm going to reach right under here. Take a deep breath and exhale for me. Good exhale. All right. I'm unable to palpate the spleen at this point. All right. Now, same thing over here. I'm just going to reach across again. And if you would, I'm just going to get you to take a deep breath and exhale. Okay. I can palpate the bottom end of the liver lobe there. All right. Now I'm going to do something called percussion. So I'm just going to tap here on your belly. I'm getting tympanic sounds with that. Now I'm going to see if I can actually find the size of your liver for you. So I'm going to use the spaces that called the intercostal space, the spaces between your ribs. Okay. As I can get it right there. So I have a little tape here I'm going to use. It would tell us how big we get your liver to be. Do that. I'm going to start from down here. Tympanic, tympanic. There we go, changing tone. Alright. So it looks here like your liver measures approximately 8 centimeters. So that's pretty much normal. So that's good. You can just stay there and relax a little bit. Any discomfort anywhere in here? No? Okay. Now while you're laying down a little bit like that, what I am going to do too is kind of test some of your, the feelings. We worry about things like some nerve degeneration as we age. So I'm going to take your socks off here. You tell me if you feel any sort of touching here that I'm doing, okay?
Touching, touching, touching.
Okay.
Touching, not touching.
Okay, good. Now I'm going to do something, this might tickle a little bit. I'm looking for something called the Babinski reflex, okay? All right, relax your feet for me. Just relax them. There you go. There you go. All right, here we go. All right, negative Babinski on the left foot. Negative Babinski on the right. Okay. All right. Now what we do is you can just relax. I'm going to go ahead and lift this up a little bit for you. There you go. Now, let me go ahead and I'll put this down. If you just sit up just a little bit here, I'm going to take a little look at your back. I'm going to do the same thing we did before, percuss. Okay, tympanic sounds, that's all normal as well. All right, the other thing we want to do is I'm going to test some reflexes for you. Okay, so just relax your arm for me. I'm going to do this so there shouldn't be any pain. If you feel any pain, let me know, okay? That's this brachioradialis nerve back here. Okay, positive on the triceps. That's good. All right, relax your arm here. I'll try that brachio on here. Okay, good response there. Relax your arm. Again, I'm not gonna strike real hard, I just want you to be aware of it. There we go. Positive response from the reflexes there. Same thing over here. Relax for me. Okay, positive triceps reflex. All right, relax there. Okay, good response there. Relax your hand. Okay, response there. All right, now I'm gonna check down here. Just relax your legs for me. Okay, got a good reflex there. Plus 2 reflexes here. All right, and just kind of relax your foot here. All right, tap right back here. Okay, positive reflex there. Same thing, you just relax your foot. This is what we call your Achilles tendon. There we go. Positive reflex there. All right. Now we also want to test to see how your hearing's doing. Okay, so I have this special little, we'll call it tuning fork. What it does is produce some sounds. First thing I'm going to do is place it right here in the center of your head. You tell me if you can hear it either one side or the other, or if it sounds equal. Okay? Sound equal on both sides?
It's equal, yes.
Oh, you sound like you're not sure. You want me
A
to do it
little
again?
more on the left. Yeah,
A little more on the left? Let's try that again. Let's make sure.
Yeah, I hear more on the left side.
On the left? Okay. All right. Now I'm going to do the same thing, but this time I'm going to put the end of my tuning fork right here on this bone behind your ear.
Okay.
Tell me when you can't hear it anymore, and I'm going to place the tuning fork right by your ear, and you tell me when you can't hear it from there, okay? Okay. So that's normal for our ears. You have what we call air conduction, bone conduction. It should be twice air to bone. Okay. That seems to be a little bit less, so we'll have to keep a watch on that to make sure that our hearing is good. Okay. All right. Now, your eye structures and everything look good. The hair pattern distribution is good. All right. Got all that. All right, now if I were doing a breast exam on a man, woman, the same thing, I would be looking for any masses, lumps, irregularities, anything that looks unusual, even nipple changes to tell us if there's anything that could be going on in terms of cancer. As far as a gynecological exam, if my patient were a female, I would be looking for things like nulliparous or multiparous cervix. On a male, I would be checking for any irregularities, growths, abnormalities. I would check the scrotum, I would check the penis. I would also look for any sort of lesions or anything to indicate any problems. If we had a rectal exam, I would be looking for basically a smooth rectum that responded to reflexes. I would also be looking to make sure there were no hemorrhoids, growths, or fissures in any of that. All right. Let's see. Do you have any questions so far as to what's going on, what we're doing? Have you had any pain?
No, no pain. Sinus problems in the past.
Okay. And as far as your sinuses right now, are they giving you any issues?
About the same for the last 6 months, like everyone else.
Okay.
Not too much.
All right. Well, we probably would get you to follow up with an ENT, ear, nose, and throat doctor.
Okay.
That way they can kind of assess that. It looks to me like right now you do have a little sinus issue, but
I did have a little balance with my sinus the other day. My balance was off.
okay. Well, good. Well, I'll tell you what we'll do. Let's go ahead and see if we can go ahead and assess and see how what we'll look for is things like your gait. All right. I'm going to start by asking you if you would just go ahead and stand up on the floor. Let me help you here. All right. So first things, okay, good job. All right. First things first. If you will, just bend over with your head kind of going toward the ground a little bit, comfortably, all right? I'm assessing your back. It looks like your hips, your shoulders, and your back all align and are symmetrical bilaterally. I don't see any curvature of the spine. Spinal muscles seem to be good. I don't feel any irregularity in the spinous processes. Okay. Are you feeling dizzy? You okay?
No, I'm okay.
All right, good. Let's go ahead and try your balance. do me a favor, and I want you to take your left foot,
Okay.
okay, pick it up and put it up against your shin of your right leg and slide it down. Good. Do the same. Go ahead, take your right foot, slide it down your shin to the left. Good. Good job. All right. Now, if you would, take a walk for me from here to the door and just do heel to toe to the door for me. Okay, a little difficulty at first, but doing quite well now. Okay. All right. And do me a favor, just walk toward the door. Just normal walking for me, okay? Good. Symmetrical gait, no abnormalities, no irregularities. Alignment on the hips and the shoulders. Okay, good. Why don't you have a seat right back up here again for us? All right, so our vital signs look pretty good. You had a pulse of about 65 or so that's a little bit low, but you're athletic, correct?
Mm-hmm.
Yeah.
Yes, I am.
So that would be expected on there. Your blood pressure, as we did on our, by both our machine and by me doing it manually, is a really healthy range. And your O2, which is kind of telling us how you're breathing, was at 100% on room air. So that looks
Great.
like it was pretty good, okay? All right, so do you have any other issues going on, anything you need checked? No?
No, I think I'm okay.
Good, well, I appreciate it.
Thank you.
Thank you,
Good to meet
pleasure
you.
meeting you. You can
Great
get dressed
job.
at your
Thank you.
comfort, okay? Thank you.